Hi, everybody. This is Lee, and I'm talking about the latest drama and intrigue, maybe melodrama, trickeration, theater, game playing with the vote on single payer that took place in the U.S. Congress recently, and the fact that there was no yes votes, and that it was either present or no were the responses when the roll call was done. And people take it the hard way, but I don't see it the hard way myself. It's part of parliamentary game playing on a political level that we've sometimes seen before. And it was interesting to see single payer spoken about at the national level, breaking the wall of silence surrounding single payer, and that more people now than ever know that it exists, that this type of healthcare system, healthcare rather than wealth care, and that it's entered national discourse, it's entered the national narrative. Whereas before, a lot of people didn't even know such a thing existed or understood it for what it was. And then I'm seeing a lot more discourse, intense discourse, going over the fine details, specifically of John Conyers' bill, and then more generally the concept of single payer. And I think that's a good thing that there's more discussion of it, that it's not been buried as it was in 2009 and 2010, and that people are discussing it openly in the midst of the absolute failures that we've seen of the BCRA, and then also the failing of the ACA, that these wealth care systems, these insurance company bailouts, and financial services bailouts that were constructed by the Democratic Party, building upon the heritage foundation of Romney Care, that these bailouts are being seen for what they are, a method of transferring wealth from the 99% to the 1%. People are making the connections, and that there is no defense of that, and that the insistence upon defending the ACA is transitioning towards advocacy for single payer health care, and that we can't afford to provide health care to everyone in the United States, but we can't do that and then break off insurance CEOs to the tune of billions of dollars. We can do one or the other, but we can't do both. And so people are saying, well, they've had about 8 years of being broke off in billions of dollars of taxpayer funds. And so now it's time for that money to actually be spent on actual health care rather than health insurance that not a lot of people can even afford to use. And so I have been taking opportunities to visit town halls and hearings and things like that. When there's a government official in the vicinity, I go and I ask my questions and make sure that it gets recorded for news media or whoever's there in the vicinity. And I did that, and I do that as a way to help spread the word about the concept of single payer and how it exists. And I did specify when I brought up the question in the recent event that Donald Trump himself was a supporter of single payer from 1999 to 2015. In written word and verbal word, he supported single payer. 2016, he distanced himself and disavowed single payer. And then once again, he started praising it in 2017. And so during the campaign, because Rick Perry, his opponent in the primary, goaded him on that, Donald Trump backed down. But now he's praising once again countries such as Australia, their healthcare system. And then also he's praised Scotland and he's praised Canada's healthcare system. Not their health insurance system, their healthcare system, and the difference between that. So I feel okay. It was weird. It was kind of like one of those games that you have to endure, but it had the consequence of making single payer enter the national discourse and actually be addressed by news media. And now people are being educating themselves so far that I've seen on the concept of it. I think it's good. And then I've talked about Bernie Sanders and like, what is he doing? Because we still hear discrepancy in his wording regarding his bill that he plans to introduce, that it's going to be a Medicare type of public option. That's not single payer. That's something different. And that's definitely not John Conyers, his bill, which is what people want and what they support. I mean, of course, there has to be some fine tuning, some tweaking to get the bill workable for the Senate and then for the nation. But people seem to be very interested in Medicare for all. And so, the government official I talked to brought up the VA as an example of what doesn't work. But most people know Medicare as it is today, as it exists today for those 65 and older, that it does work. And that with the ability to negotiate drug prices, which is allowed under 676, that it gets better. And that's the expanded and improved part, and that there are many other improvements and existing sources of funding go into that program, and that's the expansion. So it's expanded and improved version of Medicare as it exists today, and that everyone would be covered under it. And so we'll see where it goes. I mean, I don't believe that we should let Bernie Sanders off the hook and play games with, it's universal, but it's a public option. It's Medicare type, but it's, it's like, what exactly are you doing? Get Chuck Schumer out of your ear, because I think it's Chuck Schumer that's whispering in Bernie Sanders' ear, throwing him off his game. And someone needs to pull his coattail and go, shh, Chuck Schumer, let Bernie Sanders talk. But anyway, definitely, it's a step forward. I see this as a step forward, not a step backwards, and that it's going to come from the ground up, of people constantly questioning their congressmen, their senators, their House members, and bringing it up over and over. And I think that's going to continue to happen. So it's all right. No one said it would be easy, but I think our time has come. And so I say good luck.